I'm sitting in the screening laboratory at Alder Hey Children's Hospital. This laboratory screens all the babies that are born in Cheshire and Merseyside, and it screens them for very serious conditions. The aim of the newborn screening programme is to identify these conditions early so that we can get in there and treat the children and avoid long-term complications of the condition. This laboratory screens 30,000 babies a year, and here's some of the machinery around that they use. Since 2007, we've been, as part of the national programme, including cystic fibrosis in that screening test. That means that we've screened over 4 million babies in the United Kingdom in that time period since the national programme started, and we have identified over 1,500 babies with cystic fibrosis.
We're Casey and Ben, and this is Poppy. Poppy's got cystic fibrosis. Poppy lost weight continually from birth up until the point of diagnosis. Poppy was diagnosed with cystic fibrosis through the heel prick test when she was 5 days old. Initially we had a visit from a health visitor who gave us the diagnosis, and we went straight away. So it was when Poppy was actually 3 weeks old. We got the diagnosis in the morning and we were in the hospital within half an hour. The team prescribed the antibiotics to begin with, and then the enzymes. You just slowly introduced the treatment to us, so we weren't bombarded with the information.
Obviously, if we can identify children earlier, we can start them on treatments and we can help them to avoid the chronic airway infection and the other complications which impact on their well-being and their quality of life. And there's also good evidence that's coming through now that we can improve not only their quality of life, but the length of their life.
Poppy's been really well. We've not had any IVs, we've had no admissions. The team are really useful, really fantastic, and continue to support us throughout. The coughs that she does have, we do treat ourselves at home with antibiotics and additional physiotherapy. Newborn screening's a good thing. It picks up the disease early. It gives the children every chance that they can have to develop and grow healthily to lead a normal life.
There was a paper from Philip Farrell, who was a professor of paediatrics in Wisconsin, and he produced results showing that screened babies there at the age of 11 were better grown and in better condition than the non-screened ones. And so that was regarded as pretty hard evidence, and the government accepted, with our pressure, and that paper, which thank goodness came out at just that time, Yvette Cooper agreed, against the advice of the screening committee, to introduce screening nationally. That was 2001, May. It was introduced into the whole country gradually by 2007.
The Cystic Fibrosis Trust invested a lot of money into research into newborn screening, but also spent a lot of time lobbying various governments to establish the newborn screening programme. The thing that's probably had the most impact on families is an end to this diagnostic journey that many families went on, and many families found really very difficult, going sometimes from doctor to doctor with symptoms that really weren't identified as causing cystic fibrosis. It's really transformed the care that we provide to children with cystic fibrosis. Our clinics are very different now than they were 10 years ago. And it's a joy really to look after all these well babies who are coming in, and the whole ethos of what we're trying to do, the whole aim of what we're trying to do has become much more proactive, and it's much more about keeping these children really well and in good shape.